If you're waking up 3, 4, 5 times at night, you have a weak stream, or you're rushing to the toilet in the day, if this sounds like you, it is possible that you could have BPH, or benign prostatic enlargement, i.e. an enlarged prostate that is causing your urinary symptoms. If so, you're not alone. There are millions of men globally that have issues related to an enlarged prostate that causes them bother on a daily basis. For many men, they feel as if this is part of the natural aging process and that they are destined to tolerate and put up with these symptoms with no option for therapy. The traditional paradigm of medication or alternatively invasive surgery has evolved significantly over the last couple of decades. But in this video, I wanted to highlight for you and dive into a very common medication that we use to manage urinary issues. That medication is called Tamsulosin. I wanted to have a look at what this medication is, how it works, the potential side effects that you need to be aware of when you're making a decision with regards if this treatment is appropriate for you, so that you can decide if you'd like to take it or not. Hi, my name is Dr. Charles Chabert. I'm a urologist and the director of the Prostate Clinic. I've counseled thousands of men over the last 2 decades with regards to treatment choices for how they can manage their urinary issues. If you get value from the video, please give it a thumbs up, subscribe to the channel, switch on the notifications button, and as always, leave comments or questions in the section down below so that we can all learn about this process together. Okay, let's get into it. Tamsulosin, what is it? Well, in Australia, the trade name is Flomax. In other countries, the trade name can be Flomax. In essence, it is arguably the most commonly prescribed medication to try and manage men's urinary issues that are related to a benign enlarged prostate. In essence, it is a smooth muscle relaxant. It doesn't shrink the prostate, change the size or the shape of the prostate. What it does is relax the musculature of the urethra and the bladder neck to improve the way that men pee. If I can take a bit of a backward step, the prostate, as you may be aware, is a walnut-shaped gland that sits underneath the bladder. It's the shape of a donut with the outlet pipe of the bladder passing through the middle of the prostate. As we progress through life, the prostate grows, and as it grows, it compresses the outlet pipe, causing obstructive symptoms such as a slow, hesitant, intermittent stream, and potentially bladder changes, which result in more frequency day and night and rushing to the toilet. If we get into the science a little bit here, Tamsulosin specifically is in the class of alpha blocker. And more specifically than that, it is a selective alpha 1A adrenergic blocker. Basically, there are these receptors, these adrenergic or alpha receptors that are present in high concentrations at the bladder neck, so just at the very base of the bladder, and also inside the prostatic urethra. When men take drugs that are in the classification of alpha blocker, what happens is it affects smooth muscle relaxation. So there is less obstruction to the flow of urine from the bladder. And that can result as improvements in flow. So what men can perceive is that their pressure is improved. And by taking pressure off the bladder, men can also notice that the frequency with which they go to the loo day and night and urgency can also be improved simply by taking this medication. Now, alpha blockers can work very, very quickly. And in fact, if men take Tamsulosin, they can potentially experience a benefit in around a couple of hours from taking the drug. Now, in my clinical practice, I advise men when they first take the drug to take it in the evening. And the aim of this is to try to reduce the potential impact of some of the side effects that can happen in a small proportion of people. Before I get to that, Tamsulosin is a once-a-day dose. It's in the dose of 400 micrograms. Men take one tablet every 24 hours. So basically, decide on when you're going to take it. Take it the same time every day. And it is a sustained release form of Tamsulosin. So the theory is that there is a steady dose or a steady concentration of that drug in the bloodstream across 24 hours to give men coverage and resolution of their annoying symptoms for the duration of that period. Okay, let's dive now into some of the potential side effects related to Tamsulosin. And two of the most common side effects that I see are what's called postural hypotension, and the other one is rhinitis. So postural hypotension, what does that mean? In essence, postural hypotension refers to the situation whereby a man goes from lying to standing or from sitting to standing, and during that process, his blood pressure reduces. Now, to understand that a little better, as I indicated, Tamsulosin is a smooth muscle relaxant, and there are alpha receptors in our blood vessels in our legs. And normally when we stand up, the blood vessels contract, they maintain our blood pressure, so we do not feel dizzy or lightheaded when we stand up. When men take an alpha blocker, and it can be when they first start taking it, they can notice that when they stand, they feel a bit lightheaded, a bit dizzy, and a bit off balance. In its most extreme form, which we see rarely, that could potentially result in someone falling over. As I say, that is not a common side effect and not a common situation that I see in my experience. As I alluded to previously, I do encourage men when they first start taking Tamsulosin to take it at night, so that if they are going to experience some lightheadedness or dizziness, they're lying down there in bed at that time. The rhinitis, so the way I explain that is that men can feel as if they have a stuffy nose, a slight stuffy nose, which can be not dissimilar to the feeling that some men get at the time of developing a head cold, for example. Now, the probability of experiencing this, again, is low. It's around 5%, but just something to be aware of. Now, there is a situation called retrograde ejaculation, and retrograde ejaculation refers to the process of a man having an orgasm but no longer emitting fluid out the end of his penis, and that fluid actually returns or goes backwards into the bladder. And the reason this happens, again, is related to the smooth muscle relaxant effects of Tamsulosin that facilitates return of ejaculatory fluid into the bladder. Many men will say that it can feel a bit weird. Some men say it feels the same, but there's no mess. Some men really don't like the sensation at all. It's important to be aware of these potential side effects, again, so you make the decision that you think is right for you. Rest assured, however, if you were to take this medication and you were to notice some of these side effects which you did not like and the medication you felt did not agree with you, then the simple thing really is to stop the drug and the side effects reverse very quickly. Sometimes, more rarely, men can experience a lack of energy. They can feel a bit washed out, or sometimes men can have headaches. Again, these symptoms are at the rarer end of the spectrum. The final potential side effect I'd like to cover is something called floppy iris syndrome. And floppy iris syndrome really causes a man no obvious side effect that he can experience. But I do counsel men that if they are coming to cataract surgery, it's really important for you to let your ophthalmologist know so that he or she can make appropriate planning when they're performing your cataracts, as it can just make some challenges if they are not aware of this situation. So if you're waking up multiple times at night and you're planning a lot of your daily routine in your daily life around toilet visits, I think it's worthwhile having that discussion with your local healthcare provider to talk to him or her to try and work out if they feel that your urinary issues are related to BPH or the benign enlarged prostate, and whether or not you may benefit from a trial of this medication. Certainly in my practice, when managing this situation, beyond the standard assessment tests, which can include a PSA test, some urine tests, and an ultrasound, we often use the medication as a bit of a therapeutic trial, which is to say we use this medication to see if it can provide benefit and reassess the situation several weeks later. For many men, they may not like being on medication, or they wish to have one of the new, more minimally invasive treatments to try and maximally improve their urinary function with minimal impact on sexual function, and also not be on medication on a daily basis. If a man falls into this category, then a cystoscopy is often warranted. A cystoscopy is a camera test whereby we inspect and look through the outlet pipe of the bladder to try and determine a man's prostate shape and size and configuration, and really with a view to determining which one of the more minimally invasive treatment choices he may be a candidate for. I hope this answers some of your questions. If you've got comments or more questions, please leave them in the section down below. If you'd like to know more about aspects related to your prostate, have a look at this video, or potentially have a look at this video here. Until the next time, please take care of your prostate.